Hello. The title of my speech is Delayed Umbilical Cord Clamping. The purpose of my speech is to persuade you that delayed umbilical cord clamping is best for babies and should be practiced by all capable hospitals. Why? Because your baby deserves a good start at delivery. So today I will be discussing with you one reason why delayed umbilical cord clamping is not used, one objection to delayed umbilical cord clamping, and then I will summarize with you why I still think that delayed umbilical cord clamping is best for babies. So first, let's discuss one reason why delayed umbilical cord clamping is not used. Delayed umbilical cord clamping is not used on babies that are non-breathing or non-vigorous because of the urgent need for resuscitation. In reference to delayed umbilical cord clamping, the Journal of Perinatology states, however, non-breathing or non-vigorous infants at birth are excluded due to the perceived need for immediate resuscitation. Recent studies, though, have demonstrated early physiological benefits in both human and animal models if resuscitation is performed with an intact cord. That is, a cord that clamping has been delayed. But this is still an active area of research. So, although delayed cord clamping is not used on these babies, and research is still being done, there has been studies that have demonstrated early physiological benefits of an intact cord. Therefore, I argue that delayed cord clamping is best for term and preterm babies, and it should be practiced by all capable hospitals. Now let's discuss one objection to delayed umbilical cord clamping. Science Direct states that historically, delayed cord clamping caused a higher rate of hyperbilirubinemia and the need for phototherapy. But more recent evidence suggests that it may no longer be the case. Therefore, I argue that delayed cord clamping is best for babies and should be practiced by all capable hospitals. Now, in my PowerPoint, I explained to you what hyperbilirubinemia is. According to PLOS One Journal, neonatal hyperbilirubinemia is a common disease among newly born. It is also called neonatal jaundice. Approximately 60 to 80% of newborns develop jaundice in the first week of life after birth. The main manifestation is yellowish staining of the sclera and skin when the total bilirubin level in the blood rises above 5 milligrams per deciliter. Now, in my PowerPoint, I also explained to you what phototherapy is. According to Cochrane Library, the most common treatment for jaundice is light therapy or phototherapy. Babies are placed underneath a special light with their eyes covered, wearing just a diaper, so that as much skin as possible is exposed to the light. Phototherapy breaks down the bilirubin, which can be then passed out of the body. So now that we have discussed one reason why delayed umbilical cord clamping is not used, and one objection to delayed umbilical cord clamping. Let's summarize. In summary, according to the previous stated information that I gave you, umbilical cord clamping is not used on non-breathing, non-vigorous babies, but studies have shown some early physiological benefits in animal and human models, and it was once associated with hyperbilirubinemia, and the need for phototherapy. But recent evidence shows that may no longer be the case. The Journal of Perinatology states that there is a large body of evidence demonstrating that delayed umbilical cord clamping provides benefits for term and preterm infants. These include reduction in mortality in preterm infants and improved developmental signs at 4 years of age in term infants. Therefore, given these advantages, I argue that it is useful for all capable hospitals to practice delayed umbilical cord clamping. Thank you.